Welcome back, guys. Today we're going to talk about intussusception. Intussusception means that two parts of GIT tract get through each other. It's more commonly with the small intestine and large intestine. So let's imagine this is an GIT tube, and this is normal GIT tube, and this tube it is have intussusception here. Let's imagine that, and that this tube here go inside the tube in the other side here. So this causing intestinal obstruction here. We can see it in this image here also. We see this one go inside this one. You see? So with this we call it telescoping of a proximal bowel segment into the distal segment, commonly at the ileocecal junction. Most commonly adiabatic, but may be due to lead point. So what's the lead point? Lead point, that mean there is an pathology or not a pathology site of fixation. There is a fixed part. If we think this is this part is fixed and this part is mobile, so that part easily to go inside this part and making an intussusception. So it's commonly in the ileocecal junction because the cecum is fixed. And let's imagine this is the cecum here, and this is ascending colon, and this is the ileum. Also can the ileum, distal part of ileum, go inside the cecum and causing intussusception because the cecum is fixed. So let's talk about the other cause of, or the other leading point here of the intussusception. Also we may have a Meckel's diverticulum and mass or tumor. So that also causing, if we found that somebody with the intussusception, we have to rule out the Meckel's diverticulum and tumors as a result. It's most commonly in the children. The blood supply, compressed blood supply, causing intermittent severe abdominal pain, often with the recurrent jelly dark stone. Majority of cases are infants because it is the most common cause of intestinal obstruction in the infants, and usually in adult. Maybe happen in adult due to the mass or tumor in the intestine. On physical examination, the patient may be draw their legs to chest to ease the pain. Sausage-shaped mass on palpitation, we can feel it like a sausage, like a hot dog. And in imaging ultrasound or CT scan, they show target sign. What is the target sign? Target sign means this sign, like this one. We have a big one and small one here. We can see it in this image here. We have a big one and have a small one inside, small circle inside it. Maybe associated with IgA vasculitis, Hodgkin scondyl purpura, which is a purpura or vasculitis affect the blood vessel in the skin and the intestinal tract or renal as well. Recent viral infection also may be associated with intussusception. Adenovirus or Bayer patches hypertrophy create leading point. So the problem is with the leading point causing intussusception. The main treatment for it is the surgery to release it, but if there is no obstruction or bleeding, we can start it conservatively to release this intussusception.